This short video clip is to help residents of Rochdale Borough to understand how the booking system will work with regard to the Covid-19 vaccination programme that will be carried out across the borough. Rochdale Health Alliance is an organisation made up of GP practices from across the borough. The idea of setting up Rochdale Health Alliance a few years ago was to help us to work at scale when projects require one team to lead the way on behalf of GP practices and to support the delivery of care for residents across the borough. With regard to the Covid-19 vaccination programme, unlike the flu vaccine, which can be purchased in individual vaccines, the Covid-19 vaccine comes in vials of 5 doses. Unfortunately, the logistics around using the current COVID vaccines are not as easy as they are for flu vaccination. Also, from the 1st of December 2020, GP practices across the country have started to provide flu vaccinations to the 50 to 64-year-old age group. On top of that, we've got work that has been delayed from the first wave of this pandemic and also other work that has built up over the months gone by. You may be aware that across Greater Manchester, hospitals have now cancelled all elective surgery, and this has left many patients who are still symptomatic and suffering requiring to go to their GP. So on top of the new flu cohort of 50 to 64-year-olds, as well as the work that has been outstanding throughout this year, and as we head into winter, the amount of work increases, logistically, GP practices across the borough felt that it would be difficult to deliver the Covid-19 vaccination programme across each GP surgery in the borough. So this is the reason why we have identified 4 sites across the borough which will be used for the residents of the borough to go and have their Covid-19 vaccinations. The vaccine that we will be using at present will be the Pfizer vaccine until other vaccines are approved by NHS England. The Pfizer vaccine is the vaccine that was stored at minus 70 degrees and will be thawed out and stored in our fridges at 2 to 8 degrees Celsius. Once the vaccine is at room temperature, the vaccine is only good for a matter of hours. Therefore, we will be receiving the vaccine in batches of 975 vaccines, and once we receive the vaccine, we only have 3.5 days to utilise the full batch. Initially, hospitals will be vaccinating hospital staff and patients over the age of 80. GP practices across the country have been informed to be prepared for vaccinating care homes from the 14th of December. When booking appointments, the first thing to remember is that you do not need to contact your GP surgery. Your GP surgery will not be able to assist you in booking the appointment. This will be done centrally from a venue at Rochdale Health Alliance within the borough. Once NHS England has confirmed the group that needs to be vaccinated, we will generate a list of all the residents across the borough who fulfil the criteria laid down by NHS England. Those residents will receive an email from Rochdale Health Alliance through a new piece of software called QDoctor. The email that you receive or the message via text that you receive will provide you guidance on how to link to the diary to book your own appointment, and within the message there will be a specific identification code which is specific to you so that you can book in and the system recognises that you are eligible to take an appointment within the diary. For those patients who are unable to access either phones or emails, Rochdale Health Alliance will have a telephone line within Rochdale that you can ring up and book your appointment once you receive a letter that highlights your identification code. So we will be providing both a telephony service as well as electronic method of booking your appointments. Again, do not contact your GP surgery as they will not be able to book the appointment for you, and you need to wait until you receive the formal letter that the system is now ready to provide you a Covid-19 vaccine should you require one. With regard to the clinics, we will have 4 clinics across the borough. There will be 1 clinic in Middleton, 1 in Haywood, 1 in Rochdale Centre, and 1 in the Pennines area, which is around Littleborough, Milnrow. Working with our clinical commissioning group, as well as the local authority and public health, we are now coming to the final stages, which will be the named sites across the borough. The first site will be the one in the centre of Rochdale, and this is the site we will go live with before the other 3 sites become available. When you arrive at the venue, you must remember the 3 things of face, space, and hands. Come down to the venue with a face mask, and this is for your protection as well as other residents who have arrived at the venue and the people working at the venue. Ensure that you retain sufficient space between yourself and other people who have attended at the vaccination site, and we will provide gels across the venue that you can use to keep your hands clean. When you arrive at the venue, you will be met by our marshals at the front door, who will ensure that nobody has a temperature and has no symptoms of Covid-19. And from here, you will be directed to the front desk, where our staff will check your time of appointment as well as any other details that may be missing. Please do not arrive too soon. Try to arrive no more than 15 minutes before your appointment time to ensure that there is not a bottleneck of residents outside the venue. Once you have registered at the front desk, our marshals will signpost you to the vaccination site, where you will meet the nurse that will be providing the vaccination service. We will have teams working together to ensure that the vaccine can be drawn up into the appropriate syringes from the vial, and then the nurse will administer the vaccine. From here, if you have driven to the venue, you will be signposted to our observation area, where you will need to stay for 15 minutes to ensure that you have no adverse effects from the vaccine. If you have made your own way down using public transport or walking, or you have been driven there by somebody else, then there is no requirement for you to stay in the observation period, and you would be ready to move on to the next stage. Before you leave the venue, you should ensure that you have your second appointment, which will be 21 days from the date of your vaccination. Depending on demand, it may be slightly longer than 21 days, but please ensure that before you leave the venue, you have a date and that we've booked it into the diary so that you do not need to log on or contact our telephone service to book the second appointment. In the event that, having booked your second appointment, you are unable to access that slot, ring our telephone line, which will be provided, to ensure that that slot does not go vacant and we do not end up wasting vaccine that is very valuable. As many of you will know, at the moment this is a very fast moving project, and even as GPs in the system, we have had varying advice provided by NHS England and the government over the past month. Unfortunately, the system has to adapt to the criteria that is laid down by the government, and therefore we will endeavour to keep you informed of all the changes that are occurring. But as things stand at the beginning of December, we are aiming for the 14th of December to start vaccinating care homes, and soon after we will be starting to vaccinate the cohort within the borough that is identified by the government.